On today's episode, we get to speak to Georges Leconte, CEO of Harlem Hospitals, a part of NYC Health and Hospitals. It's no secret that the field of public administration isn't easy, but one thing we can all agree on is that it's a rewarding field. Learn all you need to know about working as a CEO in a New York City hospital during the most challenging of times. During this episode, George also goes into the plethora of jobs and fields one can go into with a master's degree in public administration. First, I want to thank you so much, George, for joining me on this special episode. And you can just start off by introducing yourself and letting us know more about your role.
My name is Georges Leconte. I am the new CEO at Harlem Hospital, New York Health and Hospitals, Harlem. It's a dream come true type position, having the ability to work with some fantastic folks here at a great hospital. It's a great community hospital and takes care of the Harlem group here.
Have you always wanted to work in the field of public administration?
Well, healthcare has always been my preference. You know, I've always been interested in healthcare, always wanted to be in healthcare. Part of it is my mother was a nurse. She's a retired nurse, I should say. Always had the interest in healthcare. And because she was also really severe asthmatic. There were times when, every few years she would be admitted in the hospital for her asthma. So I was always interested in healthcare and how do you improve people's care, their health. And I ended up going into respiratory because of mom, having the asthma attacks, and it worked out pretty well for me. I did a lot of asthma education in the early part of my career as a respiratory therapist and worked my way up the ladder into this position as CEO.
Absolutely. It's so great when you do work your way up the ladder because you get a different appreciation for all the other roles that you've done before, and you just know what each role entails. So that's amazing as well. But what do you think are some, I know a lot of people that do have MPAs do go into, the health field, but are there any other type of fields that come to mind for people that do have an MPA that are outside of hospitals that you think?
Oh, sure. There are tons of field. I mean, some of my colleagues are they work for New York State under the Department of Health. There's much, much, much public aspect that you can do. Public health is really a great field to go into. And the MPA, you can go into just about any field that you feel that, you want to work in. Healthcare just happens to be mine, but I had others that were working for other institutions such as DOH, Department of Health, Department of, I believe, Environmental Service was another colleague, and some colleagues were teaching also, so we had some education folks that were part of it.
Absolutely, as one could imagine. And can you speak to the unforeseen circumstances that could always occur, especially within this particular position and field? Like the challenges during COVID-19. How was it like working during the era of COVID-19?
Tough. I mean, prior to this, I was at Elmhurst Hospital, which was the epicenter of COVID back in 2020, early 2020, and it was a tough beginning. It really was a tough beginning. Myself and my colleagues at Elmhurst, we endured quite a bit, and the leadership we had there and the work we had with the staff, we were able to do a great job in terms of saving lots of lives.
That's amazing. And what are three tips or three pieces of advice that you would give somebody who wants to join the program or get into MPA in this field? What are three things that you would want them to remember?
I think the first thing I would say for them to remember is to take as much as you can out of it. It doesn't matter whether it's this program or any program. You get out of it what you put into it. So you have to go in with, what do I want to get out of it? Okay, what am I looking for to get out of this program? My thing in the program was leadership. I was looking for some leadership guidance, understanding of the government, understanding of bureaucracy. And that gave me a great understanding of it. It helped a great deal for me. I work in a public institution, so I have a great understanding of that. So one would be, what you want to get out of it, and take as much as you can, because when you go in there, you can, sort of focus on one or take a general concept of it. It gave me a really good understanding of public administration.
That is a really, really, really great point, to go in there with the intention to know what you want to get out of it. And next, I would like to know, what would you say is the most challenging and the most rewarding thing about maybe your job or being in public administration?
Most rewarding, definitely, just being able to take care of people, being able to take care of this community, is beyond any reward you can have. Most challenging, it's a 24/7 job. That's what it is. Here at Harlem Hospital, we recently had the two officers that were killed. They came to the hospital itself. So that was a challenging thing that we had to deal with. I don't know if you remember that we had two police officers that were shot and eventually died. They came here to this hospital. We are a trauma hospital, and we do provide this sort of help to the community and to our surroundings. So the most challenging. It's a 24/7 job. The most rewarding, you're helping people. You are helping people.
Absolutely. And talk a little bit about your current job. You just talked about how, you guys are a trauma hospital, and there's just a plethora of things, a variety of things that you see throughout the day. Talk a little bit about, maybe you don't have to go, completely into your day to day, but describe a little bit what your work entails, just in case somebody does want to go into, this type of work that you're doing.
Health field, and it entails understanding and providing care to our population. For us, we are what you would call a hospital that is there for everyone. We do not discriminate. We provide care for everyone, regardless of your ability to pay, regardless of your sex, religion. And we are what we call a fail-safe hospital. Okay, so people come in for help. We don't turn them down. We take care of them. We provide them with the help they need, the resources they need to be able to take care of themselves. We're a firm believer that, our goal is to make a healthy New York, and that's really what we work through. Me, as the CEO of Harlem Hospital, my goal is to make sure that we provide the best care possible for our community, to make sure that we have the resources necessary to provide that care. That includes staffing, that include equipment, that include the structure, and we're constantly upgrading what we have in terms of structure, bringing in new folks, making sure that we're providing the best care possible, making sure our emergency rooms is open and available for people to come in, having clinics open to make sure that people use our clinics and not necessarily have to use the emergency room as their primary care physicians. We set them up with clinics where they can come and get regular checkups rather than wait till you're sick to end up coming in. You can just get regular checkup and do a lot of preventive care, which is part of what we'd like to do.
This is amazing, amazing work. I just want to know, what advice would you give a career changer? Let's say there's somebody that is probably in the education sector, or let's say somebody that's in arts, or somebody that's just a writer or journalist. Let's say that they want to get into public administration or into working in health and hospital. What advice would you give them?
Well, definitely. First thing you want to do is get your master's. You need a master's to be able to work in the field. And once you have that, then you need to get a mentor. Okay, I always say, it's always good to have mentors to help you along the way. I've had several myself, some of which are still my mentor up to today, to help you, to guide you in, the direction in which where to go, and also to help you decide which way you want to go. Health field is huge. I always look at a hospital as a little city because we employed so many people into the hospital, and there's a lot of different things you can do in a hospital-based environment. You don't necessarily have to be a clinician. We're looking for all sorts of individuals. If you're into, the maths, we've got a great accounting department. We need people for accounting. We need people to register. We need people. There are so many different things that you could do in the healthcare field.
Absolutely. And that is already all the questions that I do have for you. I want to thank you so much for taking the time to speak to me, and be
All right,
well
thank
and
you.
have a great
You
rest of
too.
your day. Thank
Take
you.
care. Have a good one.
You too.
Bye-bye.
I want to extend another special thank you to George for joining me on this special episode. And for more information on our public administration program, please go to our website at www.alfredapply.com, or you can email Shay at siteprograms.com. And be sure to RSVP for our next virtual open house via Zoom, and all the information is on our website at www.siteprograms.com, CITEPROGRAMS. And you can follow us on all social media platforms at Site Programs at CITEPROGRAMS. Till next time.